SVC, but more of a benefit summary sheet as opposed, because you could end up with a carrier that has a brochure that's 10 pages long and another, which is probably not helpful for the consumer. If we're really trying to get what do they have to pay for a filling versus the root canal versus the whatever, is there any other way to describe that requirement on the dental side beyond a plan brochure?
I think what we see currently on the plan compare is that there is some variation in what they provide, since they don't follow the requirement to have the summary of benefits and coverage like health plans do, the one that's issued by CMS. So what we're proposing is that whatever they do provide for that link, they would have to have available in Spanish as well.
What's the link? Sorry.
It's when you go into the details page on Plan Compare, if you click Plan Details, for all the health plans, it says Summary of Benefits and Coverage. And then for the dental plans,
okay,
it has a name, Plan Brochure.
Okay, all right. And then the timing on which these would be provided, is that when everybody does their filings? Like when do these materials get provided?
So I think we still need to work that out, but for our sake, so PID has their own filing requirements. I think the way we're thinking about this is that this will be separate from that. We want this available for people in plan shopping for plan year, for open enrollment 2025. And so the earliest that we would even have this implemented in a release available on our platform is the release just prior to open enrollment, which is the end of September. So, I think this is separate from the PID filing requirements, at least. That's how we're thinking about it.
We're supportive. I guess we have a little bit of a concern about just the timing because of the number of SVCs. Would there be any, I would say, tolerance for the Native American plans? They're about 53% of our SVCs. Maybe be a wave two, because it's like 0.06% of enrollment, and so.
So you talk about the silver plans with the AIAN cost sharing variance? Is that what you're talking about?
I believe so, yeah.
Okay.
And so just trying to cut the volume in half and then, do the other half for 26. But in terms of usefulness, I thought maybe we could.
Is this just for Spanish?
Yeah.
It's just
in Spanish.
That's,
But yeah, I mean, I guess, it would apply to all plans that are offered on our platform. So yeah, it'd be inclusive of the plan, of all the cost sharing variants. Devin, I'm not sure what you're thinking. I think we would work, we could work with you on that, I would say. I think, in general, this is something that is our last gap in terms of Spanish language availability. So if there are a lot of those variant plans that it's really a challenge to do, and we don't have a ton of enrollment, I think that's something that maybe we could work on and have maybe something like that for 2026. But the other plans for 25, I think we'd be open to that, but I think as long as it maintains the spirit of kind of what we're trying to do, which is make that
and that's what I'm asking,
benefit.
flexibility around the spirit. That would be helpful. Thank you.
David, I don't know that I don't require that with the May filings for approval. Trying to chase that down, but I don't know that I'll get that answer fast enough. Did you run that by my folks on whether we would approve the plan brochures? Because that would bump the timeline up pretty significantly, because the filings would have to come in there.
So I've discussed it with your team, but I didn't ask the question about whether this is already a requirement. I think what we're trying to do is, I guess the way we're looking at this is that right now some insurers have it available upon request, some don't have it. We don't provide it at all on our plan shop on our platform. And that's something that we want to change and change uniformly. So I don't think that this would change anything related to how, well, I guess we didn't think that it would change anything on your side, but.
I think I think May would be a concern, I'll be honest with Carrie, because the other piece too is we could submit stuff and then changes could come back, right? Like it's not final when we submit. And you could potentially then be retranslating certain documents that you require to have changes. The September timeframe sounds like at that point, it should be pencils down and we could have the translation done and submit clean instead of potentially opening some of these up multiple times for translation and finalization, which could lead to error, right?
I just don't know if that's I mean, we generally approve certain advertising materials. I would think we look at the plan brochures and would require them to come in. Certainly, we do see the SBCs. So I don't know from a timing perspective how that we could do it without building in some sort of additional flexibility. If the carriers don't think they can pull it together by May, which may be tough for those that don't do it today, like the dentals and whatnot.
Yeah, I mean, I guess without knowing your process, I mean, I think it would make sense if the summaries of benefits and coverage in general part of the review. I think the Spanish version, like nothing would be different substantively about the plan design. Like it would have all the same numbers as far as deductibles and all that. It's just the words would be translated. So I guess Colleen, to your point, having the SBC approved and final and then translating it versus submitting English and Spanish, having both reviewed, even though the numbers and the plan information there is the same, just in different languages. So I guess it would be working out if it's possible for you guys to review just the English, have that finalized, and then Pennie gets the English and the Spanish so we can present it to consumers, knowing that the Spanish is exactly the same information.
Right.
Are SBCs final in May, like before
No, we would approve them with everything else that comes in with the filing. So, I mean, it would go part of that back and forth process, which I don't know that we typically have objections on that piece. I would generally doubt it because it's a template form, more or less, but.
You could have an issue with a plan design, right? Like, we've definitely gotten cost sharing changes back,
Yeah, right.
So that's where it becomes, you're then changing multiple documents as opposed to kind of the base English document is approved and then, you create your Spanish off of that final.
So, I mean, I'm more comfortable if we have more flexibility should something change in the interim. Certainly needing to kind of go back with it on our side and understand that process a little bit. I'm fully supportive of the concept. I just want to make sure procedurally it works. So I don't know.
And then how does the actual piece get read? Because it wasn't 100% clear to me that it was providing this to Pennie. Maybe that was just something I missed in reading this. So I just want to make sure it's very clear what the requirement is of carriers. Because it could have make available, I could have interpreted to make available to consumers directly through our sites, not necessarily through Pennie. So I just want to make sure we get the language right too, if there's an additional requirement to send to Pennie.
Yeah, so the proposal is to, as we get your English language SBCs, we would get the same in Spanish, and that would utilize the CMS template.
Can you get that from us today? Is that part of the package we send over?
No, the carriers actually give us links to their
They send it to
SBCs. So we don't actually receive the PDFs. You give us links to those PDFs. That way, as sometimes you need to make corrections, right? It's still housed on your site and we're just pointing to the right place. So you would just have to give us the Spanish language links as well. And I think we've definitely seen, we do plan preview in September, and sometimes some carriers are working still on some corrections to SBCs. That's fine. We, say that just needs to be ready in time for open enrollment when customers would see it, which would be November 1st. And so we've definitely seen at least in our previous history, that into October, sometimes even you're still making updates to the SBCs, and that's fine. Because again, we're just linking out and using to make sure those links work before customers can see them.
So long as we know we're going into it with flexibility, and I mean, you're not going to say you can't be on the exchange if something happens kind of at the last minute.
But should we have some make every attempt type of language here, maybe? Just given all the questions around it? I think we all get the spirit and are committed to the spirit, so
Yeah, I mean, I think I'm fine with that. I think I'm trying to think about how to word it, like keep the requirement while also acknowledging that maybe not all of the different AIN variants will have Spanish language in time. Maybe the timing will be a little different. So I'm just trying to think of the language around that flexibility. So if you have ideas on how we could put that in language to be voted on, I'm certainly all ears. But I think we'd be okay with that.
Yeah, we could say make available the summary of benefit and the SBC by this open enrollment, except in limited circumstances upon discussion with Pennie or something. I don't know. And that sort of gives some flexibility on the specific. I think if it's a carrier's most popular plan, and like I think that would be a harder thing to get over because there's probably more of a need for it there. But the example you're giving sounds very reasonable. Of the likelihood of that specific population needing it in Spanish is low, and it's a very small population. So maybe something like that, except in limited circumstances.
Okay. So modifying the recommendation here, the recommendation is to adopt as proposed, with limited circumstances in which, the insurer would work with us on a timeline for having that SBC available in Spanish. Same thing for dental. Again, they would be required to have their plan brochures available in Spanish, subject to limited flexibility if such was required. Is that fair?
Somebody just said that motion. Did I hear you right?
I did. I'll say I did.
There we go. Alexis moves. Somebody second.
Tia second.
Tia seconds. Any discussion? I just actually got updated from my team. We do ask for the sample SBC, the federal form, but we don't need to review and approve them. We don't approve plan brochures. So I think that helps with the flexibility and the timeline. Any other discussion? All in favor, say aye.
Aye.
Any opposed? Hearing none, motion carries unanimously. Next.
Thank you very much. Appreciate that. So, third one. This is our plan, our simplifying plan shopping proposal. So, we've been engaged in a multi-year effort to improve the plan shopping experience for our customers. This includes, we talked about the Plan Quality Consumer Choice Initiative. We've talked a lot, in this forum about what we can do on the plan side. So, as part of those discussions, as part of these projects, we've identified a problem that while choice is extremely important for consumers, to enable them to find the right plan for their needs and their budget. Competition is very important, and we value that. But we do get consistent feedback, both from our customers and our stakeholders, which is backed by research, that too much choice can be overwhelming. And really the way we look at it is the risk of maintaining the status quo is that we have customers make suboptimal plan choices because they have too many plans to shop for. They become overwhelmed, or they might just give up on the process altogether, which is the last thing any of us want. And steadily, we've seen the number of plans continue to increase. And, the way we're looking at it is that, consumers need some help in in sifting through all of those plans. So research shows that only 16% of customers have a baseline level of health insurance literacy. And because of that, our customers can be especially sensitive to choice overload. There's additional research that demonstrates that people with chronic conditions and people of underserved populations are even more prone to choice overload and adverse selection because they're overwhelmed. And I've cited one of the sources below here. So what does it look like today? Since Pennie took over the exchange from healthcare.gov, the number of plans per county has steadily increased. So in 2021, we had 7 medical insurers across the state with 2.9 insurers per county on average, and we offer 28.2 plans per county on average. In 2022, that took a big leap forward to 46.7%, 46.7 average plans per county, and has steadily increased ever since. And I did want to illustrate that this is not just isolated to urban counties. This is across the Commonwealth. Your Philadelphia's and your Lancasters, we talked a lot about that. They have 87 and 85 plan choices for Plan Year 24, respectively. But also suburban counties like Northampton, 92 plans. Schuylkill County, Rural County, 76 plans. For the majority, I think what we're seeing is that even as, like, you know, if you just divide 46 by 3, you know, most insurers are only offering, quick math, 3-something plans per insurer. But as they increase, that continues to get more and more. So in our efforts to have meaningful discussions around this topic related to plan shopping, we've kind of heard the following comments. One is consumers dread the plan shopping experience. Brokers, clients are overwhelmed with so many choices. And then we have a consumer quote from our last survey that one consumer said that there are way too many options to know what's best, so they picked a plan that was more expensive than they needed to pay. So when we think about these numbers and the marketplace, what does that mean? Next slide, Kelsey. Thank you. So we value having a robust, competitive marketplace, and we want new entrants to come into Pennsylvania, which we've had almost every year that we've been in existence. We want that to continue. We also want insurers to continue to enter new markets. We want insurers to provide plans that customers want, and it gives them additional opportunities to get the health coverage that's best for them. But in our engagement across stakeholders, other state agencies, and our customers, there's a consensus that plan choice is overwhelming for many, and that increasing the number of plans at some point, it becomes a diminishing returns. So our proposed solution would streamline the plan shopping experience while maintaining what I would say is a Pennsylvania-specific model that pairs robust consumer choice with insurer and marketplace flexibility. I think we really do value flexibility for insurers, for our customers. We don't want to stop that, but we do want to give our customers a better plan shopping experience. We also recognize that each insurer has their own unique approach to their marketplace offerings, and that an overly prescriptive approach, similar to what other exchanges have done, would be counterproductive in our market. Next slide. So our proposal is to establish a consistent number of plans that can be offered by each insurer legal entity as 3 per county, per metal level, and per product type. So by product type, we mean EPO, PPO, HMOs. And by metal level, we generally mean bronze, silver, and gold, although, there is nothing preventing insurers to come out with a platinum plan. We just have never had any.
We have. We don't know. Well, we have. In the beginning.
On the
We don't currently have it.
Pennie has never offered. There's never been
We have platinum plans.
I don't think Pennie has ever offered one. So, but I'll look at that. It's not currently being offered now.
It's not happening.
Maybe it wasn't on exchange. I know we had black.
You still can. So again, benefits are, we want our consumers to have access to the best plans from each insurer without being overwhelmed. We want them to be able to easily compare plans so that they can make the best decision for them. A challenge, of course, is this would be the first time we would enact such a policy, and each insurer has their own unique business model. So finding a solution that makes everyone happy is certainly a challenge. Next slide. So if we applied this policy to 2024 plan offerings, what would the impact be? So right now, for 2024, we offered an average of 49.6 plans across all insurers, all metal levels, all products per county. If implemented in plan year 2024, we would have instead offered an average of 37 plans, which is a 28% reduction. Some highlights on the impact to plan options are below. Allegheny, 2 insurers. We'd offer 48 plans instead of 67. Lancaster has 6. Lancaster and Philadelphia have 6. They would go down to 59 plans from their current 85 and 87. And when we looked at the numbers, the impact to enrollees in rural counties was proportional to that of those in urban counties. So one problem we've had in the past with these types of proposals is that we couldn't make a policy that disadvantaged someone in an urban area or didn't disadvantage someone in a rural area. This policy, at least according to our data, would be fairly even in terms of impact. Go ahead. Sorry.
It depends upon your market share, right? So I mean, you could have, if you have decent market share, you could have a disproportionate number of people who are affected because you have to move a significant number of people out of plans because you're limited to 3 and you have good enrollment in all of the plans that you offer, right? So there could be carriers that are disproportionately affected.
So one thing I do want to iterate is that insurers would not lose enrollment because of this policy. Those enrolled in an eliminated plan who are auto-renewed would continue to be crosswalked to the most equivalent plan by the same insurer as it currently happens. So, and this is a very normal occurrence. 10% of our enrollees that were auto-renewed into 2024 coverage were crosswalked for 2024. In 2023, it was even higher at 18%. So our customers are very used to it. It happens. It's a part. Plan offerings change organically, and this is a regular part of business already. I will say that for 2023, when we looked at just one slice, if this removed the most popular, the least popular, or the least the plan with the least enrollment of all plans in 2023, what would the impact be? About 20,000 additional people would have been crosswalked. But again, no insurer would lose enrollment because of this. Plan mapping rules would continue to apply. Next slide. So the question is, why 3 and why legal entity? So our analysis of plan year 2023 and plan year 2024 plan offerings and enrollment indicated that 3 was kind of the sweet spot in terms of what would make an appreciable impact for our customers without limiting plan choice or forcing insurers to eliminate plans that had, significant enrollment. So yeah, there was a meaningful change in the number of plan offerings, but we were not necessarily eliminating plans that had a ton of enrollment, and that is something that we certainly value. Because insurers file plans under their legal entities, our plan certification policies generally apply to the legal entity and not the parent company. And to implement such a plan by parent company would be virtually impossible. It'd be very difficult to do. So that's why the legal entity is the well, I can't do it, but that's why a legal entity and not parent company.
What's the maximum number of legal entities there are for a parent company in PA? 3.
And on the exchange, we have 3. I don't know about the off exchange other places, but on the exchange, it's 3.
So bringing back the platinum plans, this proposal would still allow every insurer to offer up to 36 plans per county. So that's 9 per metal level, including platinum. And then there are some point of service plans. Not all insurers have them. Some of you do. So you could have even more than that, but it would just vary by product type. But the point is, more than most insurers already utilize in their counties, you could still have plans up to.
I just want to make sure I'm clear on that one. So it says, so if you don't have 3 legal entities, are you still able to offer 36 plans?
Yeah, so if you
You'd be allowed to have more than 3 per legal entity if you don't have a third?
So if you had 3 EPOs, 3 PPOs, 3 HMOs per metal level, that's how you get to 36. And you did platinum plans, so.
So those aren't necessarily different legal entities?
No, a legal entity would have even more.
Okay.
And again, a legal entity.
These are just product types.
Right.
Okay.
So just if you one legal entity, you can have up to 36. Practically speaking, it would really, if we stay with bronze, silver, gold, we have, it'd be 27. But the point is, there's still a lot of plans here to work with. And we felt that this proposal was effective because of its simplicity. And it's simple, and it provides insurers the flexibility to continue to offer the products that they believe are best for their consumers, and consumers to still have the choice to buy what they believe are the best products as well.
This is Cheryl. Can I ask a question? I'm confused about the legal entities. Are you saying today there's all the insurers, the most they have is 3 legal entities per insurer, or that they'd be limited to 3 going forward?
Currently on the exchange, 3 is the max that any 3 business entities is the max of any insurer.
So this proposal wouldn't stop an insurer, a parent company, from creating new legal entities and adding plans.
That's correct. We do not. This would not limit an insurer's ability to create new legal entities.
I guess I just want to be sure that I'm clear in the conversation we just had. Are you limiting it by plan type, meaning HMO, PPO, EPO, or are you limiting it by legal entities, which in my mind is a completely different thing?
So let's pick Allegheny County. Let's say an insurer has 2 legal entities. So each of those legal entities could have a 3 PPO gold plans. And then the second legal entity could have 3 PPO gold plans, and so on. It really, instead of, if an insurer has multiple legal entities in a county, then they could offer more plans because they have more legal entities.
I think that could now position certain carriers versus others, because not every carrier offers all of their products under each of their legal entities. So you could, again, have a proliferation of certain carriers' products and other carriers' products are lost in the shuffle because their logos aren't appearing at the same rate as some other carriers. Like, I'm not.
Yeah, I mean, but that's the case now.
A
And
lot of the proliferation of plans is based on non-meaningful differences in people's product portfolios, and carriers' product portfolios. So it's difficult as a carrier who has been very deliberate with their product portfolio and had a fairly streamlined product portfolio since the beginning of the ACA, to now have to limit our product portfolio because other carriers are multiplying plans by adding dental or vision, right, and things like that, which creates consumer confusion. Some of the ways in which you'd be asking us to limit our plan offerings actually creates less consumer choice, and people would be forced to make network decisions because of limitations, or they would be defaulted into a network option that may not work for them.
Can I just ask for the non-insurers in the room what a legal entity is versus product type? Sorry.
For Independence Blue Cross, we offer all of our HMO products under Keystone Health Plan.
Oh, okay, got it.
It's just the company.
Yeah,
okay.
We're writing reasons
Got it.
that way. Yeah.
I had to be schooled on legal entities.
As soon as you said that, yeah.
And then product type is
Yeah.
HMO, PO,
Yeah,
PO, POS, EPO. So
Yeah.
So you're saying that somebody could get around this by just creating a new legal entity?
Correct.
Keystone Health Plan.
My understanding is that it's
Or we could offer more,
difficult
because if
to
we
do that.
I don't know, I don't think our license works this way, but I guess that if we found out some way that we could now begin to offer EPO plans under Keystone, we could potentially add more options under Keystone than we have today.
You could double it, right?
Yes. So
I think that defeats the purpose.
Yeah, well, I mean, it definitely defeats purpose. I just, like, we have talked about this now for 2 years. And we didn't like the idea of getting rid of the plans that consumers don't enroll in. And that disproportionately impacted one company over the other. It was simpler just to come up with a number, recognizing that companies can just move in new legal entities, create new legal entities, move that around. I guess I just don't know what a better solution is to limit the number of plans that consumers may see if we think that's an issue. I remain convinced it's an issue that, I mean, is really a challenge. If you've worked with somebody that's shopping on Pennie before, I mean, you're just scrolling like 5 pages through and 96 different options, very minimal differences in some cases, even within the same holding company. So multiple legal entities offering very similar products. So like the idea initially was, I mean, sure, it would be good if the federal government would define what meaningfully different is and enforce it. But in the absence of that, is there some way to limit this flooding of markets with hundreds of plans? And I don't know what another way to do it is. If we don't like getting rid of plans that nobody enrolls in because we think there may be timing issues, or maybe they're new and that's why nobody enrolls in them. We don't like caps on the number of plans. We've already said we don't like standardized plans, which other states do, in order to limit the number of plan options. Like, what does it leave us with if we think that there's too many plan options that challenge consumers, which they repeatedly tell us they're wrong?
And one other I'll add to that is we've also heard meaningful difference. And I think what we were trying to do with this policy is avoid getting into is sort of still leaving that to the carriers to sort of keep Pennie out of the plan design details too much, because we have heard that the carriers want to retain that flexibility and that expertise. So I think by limiting it, the idea was that it would if you have only a few plans to work with, you're going to put up plans that are meaningfully different, not 3 of the marginally different plans. So that was in the simplicity of it, we were trying to kind of get something that would get there without actually having to define meaningful difference, but sort of trying to create an environment where insurers with, the product teams you have and all the expertise you have would create products within those boundaries, and it would sort of end up being more meaningful difference with those options. And I think that is kind of a premise of this proposal, is that like anything more specific requires Pennie to get involved in the nuances of plan design. If it's meaningful difference, if it's standardized options, if it's choosing which plans to display before others, all of that is us engaging it. And then we were trying to kind of, based on what we've heard, preserve that role for the carrier, which is why the limit policy was put forth as something that wouldn't, put us into that area based on feedback we've heard. So that was really kind of the premise of it. It kind of keeps those lines clean, but still kind of the idea was to drive towards that goal of fewer plans. Because I think the other piece is that, with each carrier doing each respective business and having plans that are tailoring to different populations, the net effect of having so many plans is that people aren't finding that plan that was meant for them, right? Like this plan was created for this niche of the population, but the chance that they actually find it in a sea of all these other plans, so it almost defeats the purposes of all these different strategies by having so many plans, because people aren't able to get to that one that might be optimal to them, sort of going back to the suboptimal point. So, I think we are sort of wrestling with, if this isn't it, then what is? Because we're really trying to take what we've heard and put that into something. Anything we do in the space of trying to reduce plans is going to mean there's some amount of consumer disruption, but we tried to look at that as well and have the least amount of consumer disruption, and disruption really being a crosswalk to a new plan, not even, uninsured or kicked out of their plan altogether. So anyway, yeah, and I think the challenge here is that there are so many different approaches. We tried to find something that we thought would allow those approaches to still exist, while kind of capping that total number.
Remind me what the feds proposed to do.
That's on the next slide.
Yeah.
Oh, then move on to the next slide.
Yeah, and because we're, I guess inching up on time, the main takeaway from here is that a lot of other states take more prescriptive roles than what we're proposing here, which is why, we thought it was sort of a PA-specific kind of unique approach, not just borrowing what another state did and not being as prescriptive as some other states have been, but trying to balance that with it. And so this slide really kind of shows that our marketplace has standard plans and then 2 non-standards being proposed for the future. It's currently more.
I guess I would like to offer, as one of the plans who does have 3 legal entities, some of the origin of that goes back to kind of the beginning of the exchange and the challenges with pricing by different locations. We don't offer three legal entities of products in a rating area. So, and like, I think like IBC, we do have some separation often between HMO and other product types. I'm not suggesting we use the proliferation of legal entities to get, an advantage either in this case. I know I had suggested that product type maybe wasn't the best limiter because the EPO, PPO, HMO, I don't know, really wasn't meant to distinguish as much as other things. So I had recommended the use of network ID. And then, if those carriers that do have embedded dental and vision could agree to, look, there's a product design with dental vision and there's a product without, but it's exactly the same, that would be a way to, clearly reduce confusion on, there's no difference other than the dental vision. So I think I had proposed a couple things that I thought maybe would be more equitable and would allow us to offer some choice based on network innovation and so forth, as opposed to just the product type and that, sounds like you got a lot of feedback, which is why, we're going to still work through this and not implement for 25. But I just kind of wanted to get that out there, that was not the intent of Highmark. So, for what that's worth.
Yeah, I think we should maybe skip ahead to some other ideas that we got, because that's why, initially we were thinking we would vote on it in this meeting, but I think because of the amount of feedback we got, and that came in, in the last couple of weeks from the stakeholder feedback, we wanted to be able to take a little bit more time to work through and see if there is sort of a common approach that we can come to. Just one more slide, I think, has some of the other alternatives. We heard from some plans, network ID potentially instead of network product type. Also heard some proposed potentially 4 is a better number than 3. We also got some proposals around like some flexibility around if you don't want to do 3 bronze and 3 silver, you only want to do 2 bronze, maybe it's 2 bronze and 4 silver, like some amount of ability to like swap your plan.
I guess that's where I saw that, but then I get that one, how do you just not end up with the proliferation remaining in silver, where everybody's shopping, because that's where they're going to get the CSRs and the subsidies and everything we talked about earlier today. I'm not sure how that helps consumers. Mm-hmm. It allows carriers to be able to keep plans in the most competitive tier, but it doesn't, I don't know that it achieves the goal.
Mm-hmm. Yeah, and wanted to share that feedback for discussion and see thoughts. I mean, I think something we were toying around with too was, if there's 3 and then maybe to account for a range of flexibilities or different models, there's, a 4th plan that could be available that carriers could do different things with. Like maybe it's a innovative network or a different type of plan, just kind of have one extra flexible plan, but and that was something that was included in one of the suggestions as well. But wanted to kind of have some discussion here around like if people are hearing or seeing things that seem as like a viable path to kind of come with maybe a little bit more flexibility, but kind of still at that ultimate goal of reducing the sheer volume.
I would just say from the consumer perspective, we surveyed a subset of the folks we help. And mind you, these are people that sat down with a navigator. 67% of people said it's still too much choice. And I look at the federal guidelines, it's 2 plans or 2 products, right? Like, I think it's a fair compromise because I think we're not going far enough. If you look at the numbers, it's still overwhelming choice for consumers. So I think we need to solve this. It's gonna help get more people enrolled to the right place network. So I would say I want to go further, but I think this is a fair compromise. Because, I like standardized plans.
This is Cheryl, and I mean, I think we certainly support, making this less confusing for consumers. Absolutely. Our concern was we didn't want to throw out the baby with the bathwater, so to speak. It was on a expedited timeline that would have required us putting it in place for 2025. And I think the good news is you've gotten all these suggestions from stakeholders, different ideas for different approaches, and sitting down with, taking the time to sit and bat around some of these ideas and make sure we're not having unintended consequences. For example, I think, you mentioned that, some innovation may be thwarted, and that would be our concern, because we do have some plans where the membership is just building because it's a new idea, waiting to take off, virtual only plans and things like that. And we just don't want to hastily do something and inadvertently impact consumers in a negative way. But I think sitting down with the consumer advocates and other stakeholders and maybe even having a work group or something to come up with many different ideas, I think we'd welcome that.
So ultimately, the recommendation is to consider a final proposal during the May board meeting for 2026. How do we propose narrowing the options for May to get to a point where we can make a decision?
So I think since we got a lot of the feedback from the stakeholders, like there was a lot of very thorough feedback, which we appreciate, and that came in about 2 weeks ago. So we really haven't had a chance to kind of bring all those suggestions, put them in front of a collective group and say, where's the middle ground? Is there anything promising here? And I think that's what we were hoping to do with the extra time, because we just, the timeline alone, haven't been able to bounce different ideas off of different parties to see if there's perhaps something that people can start coalescing around. If 3 isn't the right balance, or there's some alternative of adding for innovation or something like that, trying to figure out a way to get to that over the next couple of months.
So in the next couple of weeks, then, can you go through and start having maybe one-off conversations with board members? Obviously, we can't get back together. For sunshine and everything other purposes, we can't group email together for the same reasons, but I think you can narrow the options to hopefully kind of at the staff level come up with what you think would be a number of compromise options that we can bring forward in May.
Yeah.
We have to vote in May, correct, to have the timeline?
Yeah, I think we were targeting May because we did hear that this timeline is too fast for the plans. We wanted to make sure that whatever was adopted, there was enough time to work that into the whole cycle. So we thought the May timeline would be most appropriate.
They develop plans at the end of the year prior to when it's due. So, they've already started figuring out what they're going to give us in May. So to make it applicable for 2025 would be very difficult. But if they know the rules of the road for 2026, or at least the intent of what those rules are going to look like, they should be thinking about it different as they prepare the plan options this summer and into the fall.
But it is fair to say that there would be some time even after May, given we wouldn't, the important thing is don't wait till next February, right?
Right.
But not that we don't, we will work to help narrow the options, because I do think more time is better to get us all straight. But I think to answer the question, we would have a little bit of a window there.
Yeah, because I think reading the room, the intent is to get something done. And if we put it up for a vote today, we probably would get something done. But I think in the interest of pursuing consensus, giving this extra time to May, hopefully we can get to a place where we have a consensus board vote on a solution that we think works for everybody. And if we aren't there yet by May, maybe we take a vote in May. Because I think if I'm reading the room, we want to have some sort of limitation on the number of plans that are available. And I think when we go into these deliberations with staff, I think that should be the mindset as the board members go in and try to work with compromise for Devin and David, recognizing that, there'll be a vote. And I think it may be as early as May, so we can get something on the books to start to look at this more carefully for the 2026 year and the options that are available. So I don't think we even need a motion then, in this case. You'll just bring it forward, start these conversations, I think sooner than later. And once you get a chance to go through all the data, you can kind of come to the board and we'll start to have those conversations so you can have us some concrete choices in May.
Is there any way that, and I know I asked this of you, Devin, when we spoke, to be able to share out more thorough detail on the comments that were provided? Because we only get a small sampling, I would assume, in this deck. And there may be a way in which if we can see, even if you don't attribute it to a specific carrier or whatever, but it's hard to find compromise when you can't even understand where you might have common ground.
So we selected quotes from the feedback form that we got that tried to be representative of all of the insurers who provided comment, which you all did, and it was much appreciated. We try to pull out those quotes that would really to really illustrate how different the the requested modifications were. So we try to, we try to have our sampling kind of reflect that feedback. So I'm not sure what we are allowed to share, but we did try to make that, to lay out the gamut of suggestions we got.
Well, for example, I hadn't heard the proposal by legal entity. So I don't know if that came from somewhere. Or maybe I missed it, but I think to Colleen's point, if we knew, look, we have 3 carriers saying this, 4 carriers in favor exactly how it is, whatever, when you guys kind of send out the options to give some indication of, you got closer to consensus here,
Yeah, I think we can do a deeper dive on the comments because some were quite extensive. So I think when we bring a group together, we can provide a little bit more detail and background on some of the comments that were received.
But I think we're saying before May.
For the discussions that we would have very quickly to prepare for me. Yeah, so it would be in advance of that to maybe have that more detailed conversation. To Colleen's point, just to maybe there is something in the way something's being described, or alternative is that, oh, well, maybe there's something there. So I think we can pull that together, the more detailed feedback for that detailed conversation.
Thank you. And while we're talking, just to keep in mind the goal here, because I know we're talking about compromise and consensus, but it's also, the goal is to make it easier for consumers to enroll in the plans.
Right.
People run away when they see how many options are. They will not enroll. I can speak to family members not enrolling in insurance because, I don't know, there's 900 options. So, the compromise is not, it should be with the consumers in mind. And I agree with Antoinette. I think 3 is too many. I think we need to, I do think we need standardized plans eventually. And I think the meaningful difference has to be there too, on top of if we're gonna go with 3, fine, we're gonna go with 3. We need some kind of meaningful difference, because otherwise people just have no idea why they're looking at 3 plans that's almost the same. And it's not gonna help you get more, it's not gonna help insurers get more customers if they just walk away from the table entirely.
And their shoppers in general are not as savvy as we are. They're not clicking on the plan brochures. They're not checking to see what the differences are. They just see 2 of the same names. They're like, oh, well, this one's $5 and that one's $10. I'll choose the one that's 5. And they're choosing against themselves. So the more, I'm preaching to the choir, but you get it.
And I understand the desire. I don't know what an innovative network is. I'm gonna just confess. But I can probably guarantee that a consumer is not gonna know what that is. So something's gonna have to be in there to let people know, like if we're gonna consider other options. Like maybe you can have fewer EPOs if you have an innovative network, but the consumer's gonna wanna know what that means for them.
And I think that's the concern. If somebody is in a plan with a network they currently are using is eliminated and they're now defaulted into a plan, that really affects their choice of providers. So innovative could be a limited network, a tiered network, things along those lines. I think we heard Cheryl say virtual care only option. That would be an innovative network design, right? If say somebody wanted to keep that virtual care network in there and somebody's in, I don't know that they would default somebody into that, but if your plan choices get limited so much that you have to default people into that, all of a sudden now somebody's been dropped into a virtual care only plan, and that is not what they want at all, right? It's those types of things where somebody maybe has a broad network today, they can choose from any doctor in the network, and then now they're going to get defaulted into a limited network plan because that's the lower price premium and where the bulk of the membership is. So now all of a sudden the doctor they could go to this year, they can't go to next year. Like those are some of the things that we're concerned about from a consumer perspective. It's for the existing member population and what the implications are of shifting and defaulting people into plans. And then all of a sudden they're like, wait a minute, I woke up and as of January 1st, the doctor I usually see, I'm not able to see anymore.
So you've got your work cut out for you between now and May when there's an intent to vote. So hopefully we get closer than we are today, but believe you and David can
I'm an internal optimist, so I think we can.
navigate that through because, I mean, I
We can
think,
do it.
I think people are itching to vote. And that's what these meetings can be for. So.
Can I ask, are you opposed to having a working group or a committee? I mean, is that something that would be subject to the Sunshine Act? Because I would like to not only hear from insurers, but also I'd love to put ideas together with the consumer advocates and the agency heads and just get input from the, broad spectrum of folks.
I think if a group comprises at least half of these board members, it's a public meeting or has to be a public meeting of this board.
So,
The advisory committee.
That's not these board members, right? I mean, that's
So
a
we could have someone else.
different group. Yeah, I mean, we could have people that aren't board members, but if 6 board members show up at a meeting to talk about Pennie business, it would have to be sunshined because it's a public meeting.
And the Plan Quality and Consumer Choice Work Group does have representation from all the groups. I think if there is a desire to have the conversation at this level, maybe it's worth some interim meetings that are sunshine, so maybe we can look at those options and just see if it's worth to have a couple interim meetings for people who want to discuss it at that level. But I think we also meanwhile have the working group, so also maybe it's some more specific or tighter connections with the folks on those groups to make sure that there's alignment and discussion around in that forum.
I mean, I think
I would just say if we're gonna discuss that in those working groups, we would probably want to put someone else on the consumer side that has more expertise in that working group.
Okay.
And I'm sure others might agree.
Yeah, I mean, I think you and David need to go back, aggregate the information, see what more you can share with the groups, start the one-off conversations, and then we may need a special meeting or two in between now and May to just navigate through to help it out, because I don't think you'll get there on one-off meetings, but you may get us much closer. But we'll sunshine them, we'll have an hour here, 2 hours there, a time or two between now and May, hoping to work towards where we can all get on the same page. Does that make sense to everybody?
Yep.
Frank, Cheryl, you good?
Yeah, that sounds great.
Thank you. Yeah.
Thank you.
With that, it is 3:00 and we did not end early. So appreciate everyone's time, safe travels for everybody, and we will hold this meeting adjourned.